Hello, everyone. I am Dr. Muhammad Tawab Khalil, and I'm the co-chair of ISPRM Communication Committee. And today we have with us our honored guest, Professor Fary Khan. She is the Director of Rehabilitation Services for the Royal Melbourne Hospital, Australian Rehabilitation Research Centre, and Professor in Department of Medicine at the University of Melbourne and the Nossal Institute of Global Health and Monash University. She also works with the executive for the United Nations International Council for Caring Communities representing the medical disability. She will be delivering her keynote lecture on evolving role of rehabilitation medicine in global health in the upcoming conference of ISPRM in Cartagena on 7th of June 2023. Welcome, Professor Khan. How are you doing today?
I'm good, very good, thank you. I'm very delighted to be here to speak with all of you today and looking forward to seeing you all in Cartagena next week.
As we all know that we are going to gather in few days in Cartagena, which is a very beautiful city, which is full of history and delicious food. So, Professor Khan, what is in your to-do list for Cartagena when you land there?
Thank you, Tawaf. It's very exciting. We are just planning our final trip to, final little things to plan for Cartagena trip. So we were just putting our visas in, and that's thankfully not so onerous. But Cartagena is at the northern tip of Colombia, and it's near all the Caribbean islands and so forth. And it seems beautiful. I love the photos, and especially of the old city. And the food is amazing. And I'm told the people are very friendly. And we're very looking forward to seeing that beautiful part of Colombia.
Professor Khan, can you give us a brief overview of your keynote lecture that you are going to deliver on 7th of June in Cartagena?
Yes, thank you, Tawaf. So I'm looking forward to delivering this one of the keynote lectures. We have a number of very interesting lectures by very important people who've contributed tremendously to the ISPRM and its agenda. So the topic that I'm going to talk about is very much about global health and health inequity globally, and how the ISPRM can address some of those inequities in health. And what's really exciting is that this past week in Switzerland, we had the 72nd session of the World Health Assembly, in which the Strengthening Rehabilitation Health Systems proposal was approved unanimously by a very large number of member countries in the WHA, the World Health Assembly, which basically is very exciting because it puts rehab medicine right in the forefront of what governments should prioritize. And that includes advocacy for rehabilitation medicine, looking at the rise of the non-communicable diseases, and also the poverty and the pre-existing disabled populations in the world that are further put upon by disasters across man-made and natural disasters. In addition, there is a lot of refugee crises, as you know, and then we've had the recent pandemic as well with COVID, which thankfully is almost over but not fully over. So it's created a lot of stress on governments in order to provide equitable health to many of their populations. In particular, in the Western Pacific and Southeast Asian region, as we know, the need for rehab medicine physicians and integrated care and organized rehabilitation services is really a priority in my mind, because many of the developed countries, including Australia, have got very well-defined systems in place, including universal healthcare systems. And one of the exciting things about this WHA, the World Health Assembly proposal ratification, is that governments will be mandated to look at their disabled persons' policies, the advocacy, the educational, the empowerment of those people, taking away the barriers, facilitating access to healthcare. All of that is going to be at the forefront. And, that's very exciting for us, because it's been a long time that many of our member countries that are developing or in the developed world have struggled with this for some time because of this inequity in healthcare resource distribution by governments and so forth. But also, it puts in the forefront the plight of the persons with disability, those with new disability and those with pre-existing non-communicable problems, which are all amenable to rehabilitation. So in my mind, ISPRM has a lot to offer in terms of our multiple national societies, our task forces, our special interest groups, and our various committees that are committed to furthering the agenda of the ISPRM, which is to strengthen rehabilitation with its new partners. And that's not just the endorsement by the World Health Assembly of how rehabilitation can be strengthened, but also we are working with other international non-profit organizations, and that includes the World Rehab Alliance, for example, and many other INGOs. So together we can definitely make a difference. And part of my lecture is hopefully going to get more interest from our members, both national societies and ordinary members, to basically put their hand forward and do projects that will support the development, the evidence-based, the building capacity of our workforce, and furthering our agenda to further our specialty.
Yeah, that is great. I just have another question. As the rehabilitation medicine is evolving through the time, so how do you see the practice of rehabilitation medicine is going to be changed in the future for physiatrists all around the world?
Basically, I think the question is now or never. The question really is now or never, because it was always understood that rehabilitation, especially rehab medicine, was providing personalized care to our patients way before personalized medicine became sexy with other disciplines. We've been doing interdisciplinary, transdisciplinary, and multidisciplinary care forever. And it's only recent decade that other specialties have gotten on to multidisciplinary meetings and, all that stuff. So we've been doing this for a long time. The moment for us is now, and it's really crucial, because previously the WHO had put in place they published a lot of publications that look at how the plight of the disabled can be addressed by individual countries, by individual societies, and by regions, rather, World Health regions. And that's been well and good. But now, for the first time, the ratification of strengthening rehabilitation endorsement by in all countries just about in the WHO is a huge step forward. And so we need to really take this opportunity with both hands and basically move forward as along with our national societies under the banner, under the umbrella of ISPRM. And the reason for that is that so far, many individuals within the ISPRM and individual societies within the ISPRM have done good work. And, we've got the curricula, for example, for rehab medicine training. We have capacity building initiatives that many people are generous with their time and effort, and they have tried to further the agenda of our society, the ISPRM. But now it's more time to come together for coordinated, integrated, transdisciplinary approach, because together we can make a difference by advocating for our discipline, for the disabled persons, for access to healthcare, for universal healthcare, put in place evidence-based practices, fine-tune how we deliver services, learn from each other, and have some sort of policy and statements or like a roadmap perhaps to how we can further rehabilitation and its provision of services in not just the developed countries but also the developing world. And many of those countries are, for example, in our region, Southeast Asia, the Western Pacific region, they are most needy. And it would be probably really wise to take this opportunity working with the World Rehab Alliance, for example, because now ISPRM has an understanding with them, and we're lucky to have 3 rehab physicians who represent our discipline on the WRA, and so it's a combined collaborative effort and a huge opportunity.
Thank you so much. Thank you so much, Professor Khan, for giving us time for this very essential interview. So I hope to see you soon in Cartagena. And thank you so much for giving us your time.
Thank you, Tawaf, and also thank you, Andreas, and everyone, because it's wonderful to have our younger ISPRM rehab physicians having these discussion points with many of the older persons like myself within the organization. And the young ISPRM and the communications arm of the ISPRM are incredibly important, because you can disseminate those messages, and it's not always easy for everyone to get involved, and perhaps through your communication platform you're able to reach a much wider participant base than we could otherwise. So very, very happy to see yourself, and also look forward to seeing all of you in Cartagena. Thank you.